John Hill, welcome to 7:30 South Australia.
Thank you very much.
Do you support collocation of the two hospitals?
I think it's an idea that is very much worth exploring. When we looked at moving the RA to the new site 5 years ago, we explored this, and it was certainly an option that we were progressing. We did the business case, and it just didn't stack up at that time. The amount of capital that had been invested in relatively recent years in the existing site was still pretty usable, and so on a cost-benefit analysis, it didn't stack up.
Liberals say they're committed to it. Do you have a firm plan rather than it just being a nice idea?
Well, I'm not sure what the Liberals are saying when they say they're committed to it. When are they going to build it? How much are they going to spend on it? What's their timeline?
Well, I could ask you the same thing.
Well,
when are you going to build it? How much are you going to spend? What's your timeline?
That's why, as I said, I went and visited the Women's and Children's yesterday. I spoke to the staff and they asked me the same question. They said, it'd be very popular if you were to commit to this. And I said, look, I think it's easy to be popular, but it's difficult to tell the truth. And the truth is the capital in that building still has a fair way to go before it would be written off. But at some stage it will be, and then at that stage government will be able to contemplate moving it to the adjacent to the new RA. And there is plenty of room there. That's the point I made to them. We've got room on the new RA site to expand that hospital by about 30%, and that could include the Women's and Children's. And I think it's logical and a sensible thing to do. I can't see it happening in the next 10 to 15 years based on what we know about the capital that's already there. But it could happen.
And what the doctors have said to you this week is that you risk lives in doing that. If you pull these things apart, have more separation than currently exists, you risk lives. Are you prepared to do that?
Well, we haven't pulled things apart. The Women's and Children's has always been a standalone hospital.
But you're creating a greater distance between them. That seems to be the suggestion that they're making.
Hardly. I mean, the distance between the new RA and the old RA and the Women's and Children's, I haven't measured it, but I don't think it's terribly different. Arguably, it's even closer because it's just down the end of the road and then you turn right rather than turn left. So I don't think you could argue that it's any further away. There are about 8 to 12 times a year when patients have to be transferred from the Women's and Children's Hospital to the ICU at the RA, and we're reducing that by putting specialist service in the Women's and Children's to cope with a third of those people. We also are going to upgrade.
Just to interrupt you there, if you don't mind.
Yeah, sure.
In doing that, you're showing that it actually having them apart, irrespective of how far apart, is not the best outcome at all. 8 times a year, well, you might want to take the risk of losing 8 lives. Surely collocation is the best solution as soon as possible.
Well, I don't disagree that collocation is a good idea, and as a policy outcome it would be absolutely admirable, but everything costs money. It's another $600 or $700 million, and we have other priorities in health as well. We can't do everything we want in one go. And when we analyse this, the decision was made to leave the Women's and Children's where they are. I mean, they were put together two separate hospitals many years ago now, and it's functioning very well. In fact, as I've said to the staff yesterday, it's our most productive and our most efficient hospital. It works better than any of the other hospitals we have in the metropolitan area. So the hospital works very, very well. There's a handful of cases which are transferred. I don't believe that anybody has been at risk as a result of those transfers, which are handled appropriately. In the long term, I think they ought to be together. There's room on the new site for that to occur. I think it's strange, though, the Liberals are promoting this, because a couple of weeks ago they were saying we shouldn't have built the new RA where it is because the land was so polluted, yet now they want to put a Women's and Children's Hospital on the same site. Their position isn't coherent. I think what it means is that they've actually changing their policy position. This was a way of doing a big backflip and saying we now support the RA being there, and this is a kind of extra bit of spin they've added to it to try and create a bit of distance between them and ourselves.
The AMA has also, in their letter to you, or letter to the Premier, said that they'd like to see gynecological services rationalised in central Adelaide from 3 down to 2. Is that on your agenda?
Well, we have gynecological services at the RA and obviously at the Women's and Children's Hospital, and that does raise an interesting point. If the Women's and Children's Hospital were to be co-located, would it be a separate hospital adjacent to an adult hospital, or would they been integrated so you'd have one hospital? We're
almost out of time, so let's be quick. Are you saying in a sense there to the people at the Women's and Children's, be careful what you wish for, because if you're co-located you will actually lose your identity?
Well, that's something that would have to be determined in the future, but I think think that's one of the things that is likely to be contemplated by a government in the future. You wouldn't have two hospitals adjacent to each other, you'd combine them, which is what happened with the Women's and the Children's Hospital when two separate entities came together, and you create one administrative service and you share facilities and share staff and the like. And I think that's what would most likely happen if they were co-located on the same site.
Minister, good to have you with us. Thanks very much for your time today.
It's a great pleasure. Thank you, Simon.